Hi guys, today I'm going to talk a little bit about some consult tips for the TCs when you're meeting with an Invisalign patient. First thing is, we always want to encourage the patient by telling them that they are an excellent candidate for Invisalign. A lot of times patients coming into the practice, especially if they're an adult, grew up in a time period when there was no Invisalign, so all they know are brackets and wires. Likewise, a lot of the teenagers coming in today are more aware of what their options are. They're also very active in their lifestyles, from playing sports and doing dances and various things that lead to maybe a better experience with the clear aligners versus braces. Also, their faces are plastered all over social media, so they're very image conscious, let's say. If the TCs explain the Invisalign process and present the fees appropriately, you'll get patients that say, okay, I like Invisalign, I think that's a good option to fit my lifestyle, and we'll move forward. Now, if they have objections to this, then typically what we see is that we want to find out what the patient cares about the most, the patient and family. So again, we're trying to tap into what is their lifestyle. Teens care about, as we just said, their look or image, comfort, lifestyle fit, whether it's playing sports, school photos, they're in the band. Parents have sometimes a different outlook and priorities. For them, what's most important is convenience. Less appointments, less emergencies are always a good thing. If you tell a parent, hey, you're going to be in our, we love seeing you, but you're going to be in our practice a lot less often, to them, that's a big positive. They also care about the cleanliness of their kids' dental health and hygiene. And if you can remove the aligner, clean your teeth better, that's always another added benefit versus doing traditional brackets and wires. And also, finally, cost is important. So keep these things in mind when you're talking to a teenager and the parent who is typically the decision maker in making the purchase and deciding which modality of treatment they go with. Third tip is debunking the myths. So a lot of times patients come into the practice with a very poor understanding of their options in doing treatment, especially when it comes to Invisalign. Again, a lot of times they assume that Invisalign automatically costs more. Sometimes they assume that it doesn't work as effectively as braces. And what if I lose an aligner? So let's just take each one of these and go down the list. So if it costs more, that's okay. That's not very unusual, although more practices today are offering braces and Invisalign at the exact same cost to make it equal opportunity for the patient to choose the product that best fits their needs and the one they want, or best, I guess, the experience they best want. But if there is a difference in price, I think it's a very simple mathematical calculation just to take the difference and divide it by the number of months of treatment and try to narrow down to a monthly cost. So it's a little more digestible for the patient versus it being a gross difference in cost. For the second point there, it doesn't work as well. At this point in time, the Invisalign technology has completely evolved to where Invisalign can treat basically anything braces can treat. So that's we're well past the point of this even being a realistic objection. What is an easy answer to that is having before and after photos of your patients who have gone through treatment successfully with Invisalign. Photos are worth 1,000 words. Videos are worth more than that. So if we have videos, maybe a ClinCheck that you can show them, the more visuals, the better. With lost aligners, that's an easy one. We just tell them to move on to their next set of aligners, depending on how far away they are in terms of the days of wear for that specific set. Or we can replace up to 6 sets of aligners at no charge when it's a teen patient. So very easy. It gives them kind of the risk-free safety net, if you want to call it that, to where if their concern is losing aligners, then no problem. We can fix that quickly and easily for you at no additional cost. Fifth thing is explaining the benefits of Invisalign. A lot of times in the sales world, we teach about features and benefits. And that's basically what we're trying to supply to the patient here. And again, the point is to reassure the patient that, yes, it works. Let me just go down the list here. It's less noticeable, so the aesthetics are better. It's more comfortable than braces. If you can imagine wearing braces and playing sports, getting hit in the mouth, which a lot of us have had that experience, it does not feel good. With Invisalign, you practically have zero emergencies. Braces, we have often emergencies where a wire is poking out or a bracket has gotten detached from the tooth and they've got to come in, which is painful for the parent, it's painful for the doctor, it's painful for the office. It's also just less overall appointments. That's one of the beauties of Invisalign, is that the efficiencies of it require less time per appointment and less total number of appointments than doing braces. So again, that translates for the parent and the patient that they're just coming into the practice less often. Better hygiene, they can clean their teeth better, they can eat what they want to, so there's no diet restriction. So all of these things you want to clearly explain to the patient so they have a good understanding of what this experience can provide to them. Sixth thing is attachments. A lot of times patients are choosing Invisalign because they do not want stuff glued to their teeth, as what happens with braces, but sometimes we need an attachment on tooth to actually get the movement required. And so I think it's one thing is explaining the purpose of an attachment, and it's like I just said, if we're needing some extra grip on the tooth, if it's a complex movement, like a rotation or an extrusion or intrusion, we need the attachment to actually accomplish that. A lot of times the plastic has advanced so much where we can get the movement without needing an attachment, but in some cases we do need an attachment. And in those cases, it's just showing them an example of what it looks like, which basically an attachment is virtually invisible up to 3 or more feet away, as you can see in the photo here. And so I think if you can have some visuals to show patients wearing attachments and how not very noticeable it is, it will go a long ways with helping your patients be comfortable moving forward with this option. And if she can do it, so can you. Seventh point here is setting proper expectations with refinement and IPR. These are very normal parts of the process. I think sometimes we get a little bit hung up on number of refinements with Invisalign. It just depends on the length of case, how well they're wearing the aligners, and also the types of movements we're trying to accomplish. But this is a very, very normal thing to have a refinement at the end of treatment, because we're trying to just tweak the final positioning of the tooth so we can get the smile looking as perfect as possible. IPR is a separate concept that sometimes patients get a little bit sensitive to, depending on how you present this. So you always want to be clear with your verbals and your wording to your patients. So we don't want to say we're stripping teeth or we're slenderizing teeth, we're removing enamel. Those are things that will scare your patients right out of the practice. So if you can reword that and use some more comforting terms like polishing, it's a mani-pedi for your teeth, we're smoothing the tooth, we're lightening the contacts between the teeth, it'll help. And finally, what we call the get out of jail free card is, if this does not work, we will move you to braces at no additional cost. What we know and have seen from doctors who have used this policy regularly in their offices is that it creates that safety net for the patient to feel comfortable moving forward with treatment. But conversely, rarely do you have a patient switch from Invisalign to braces. Once they go into it, they rarely come out, just because, again, the experience is superior to doing brackets and wires for all the reasons we just named. There's some tools here too that we can provide with. One, or the easy one, is the Typodont, so you can show patients what clear aligners look like on a Typodont. They can take the aligners off, touch them, feel them, get a first-hand experience with what they look like and can feel like wearing them full time. Second thing there is having just a quick, promotional sheet in the office to highlight, this is why we love doing Invisalign, so patients can review this and understand the reasons why you like doing Invisalign. And finally, as we discussed earlier, is having the visuals to show patients and reassure them that, yes, Invisalign is a very proven treatment that we have used in our office consistently. Let me show you some patients like you who have shown a similar positioning of teeth, and we have treated successfully. And that is the end of the presentation today, so please let me know if you need anything. Thank you.